Canada will not issue visas to residents of countries with Ebola outbreaks. Toronto, Canada is following in Australia's footsteps and has closed its doors effectively immediately to people from the West African countries battling Ebola, in a move that puts Canada at odds with the World Health Organization. The federal government said Friday it is suspending the issuance of visas for residents and nationals of countries with widespread and persistent, intense transmission of Ebola virus disease. As well, work on permanent residence applications for people from the affected countries is also being suspended. The stress on countries with widespread transmission provides an out for the United States, which currently still has at least one active Ebola case within its borders. At present, only 3 countries meet the definition of widespread and persistent Ebola transmission: Guinea, Sierra Leone, and Liberia. An international law expert denounced the move, saying it was a violation of the international health regulations, which Canada helped to draft in the aftermath of the 2003 SARS outbreak. And David Fidler, of Indiana University, said the decisions of Canada and Australia to close their doors to the citizens of the affected countries threatens to further undermine the IHR, as the treaty is called. The whole thing that so many years, and so many efforts, and so much money was spent on just seems to be disintegrating in this Ebola panic, Fidler said of the treaty. And to have countries like Australia and Canada be in the forefront of this is even more disheartening, because they had been shoulder to shoulder with those trying to build these regimes, these approaches, and to keep us focused on having a disciplined approach in a disease crisis. Now they are back to allowing fear and politics drive responses to a disease threat. And we know that only ends up in a bad place.